Guess what? The Minimalists are going on tour with a live version of the Minimalists podcast, and I want to invite you to join us for a night of less. Find your nearest city at theminimalists.com/tour. We'll see you there. How to keep up with good habits when you are depressed. So how do you keep up with good habits when you're depressed?
That's a difficult one, right?
Yeah.
Because depression, it depends what we mean by depression, obviously, right? Do we mean brain inflammation that is causing some sort of neurochemical response, or do we, when we say depression, do we simply mean sadness or feeling like I'm in a funk, or I stubbed my toe and now I'm feeling depressed? So we use this term depressed very loosely when there is this spectrum of emotion. But let's assume that Liza here means clinically depressed.
Capital D depression.
Yes, yeah. And in fact, what I would say is that quite often our habits are what help us out of the depression, or a routine can help us out of the depression. But I'd love to hear your perspective.
Oh, that's so tricky. Of course, if I was sitting with Liza, right? If she was here and it was her and I alone and I had the space and permission, I'd say, tell me about your life, Liza. Because there's probably something there. I mean, there's usually something there.
Yeah.
And so I would be remiss if I didn't try to understand what brought her to this particular moment in time, feeling this particular way.
Right.
Habits or no habits, it can be, if you've had a lot of loss, a lot of trauma, a lot of deprivation as a child, it can be hard to take care of yourself or get into self-care habits or to move away from self-harming habits.
Right.
Because that script is set. And, if there are any therapists listening to this, the superficial sort of, well, let's just deal with what's happening now because the past is in the past is, I think, short-sighted. And I think we're underserving people. I think the way that we serve people is by helping them go deeply into where it started, right? I mean, I meet people all the time, who come to the care farm to do work on grief that happened when they were 6 years old, because that's when their father shot himself. And now they're 40, and it's affected his whole life.
Without him even realizing it sometimes,
Without
right?
even realizing it, and other people blaming, him for these maladaptive behaviors that were coping mechanisms when you're 6 and your dad shoots himself and the whole family is spun out, right? And they just become part of your habitual patterns.
Yes.
Right. And so I would really have to take her deeper into that and say, let's talk about this. Right. Because it's hard to self-motivate when you're being weighed down by the unexplored past.
Yeah, the word that stands out to me here is habits, and I like to delineate habits from routine. And of course, she also says good habits here, which is important to recognize, because just because something is a habit doesn't make it a good thing. In fact, most of our habits tend to be bad habits when they aren't intentional, right? When we haven't when we haven't been deliberate about bringing these new habits on. So I think if I were to rephrase her question, maybe the thing that I would say is, how do I keep up with a good routine? Because if it is truly habitual, then it is just a habit. You will continue to do it. But when trauma strikes or depression strikes, something like that, it may throw your routine off significantly. And the thing that has helped me in the past when dealing with depression or dealing with trauma is having those habits to actually to fall back on, and when they are truly habitual, whether it's exercise or reading or writing, I tend to do them even on the bad days, so to speak, and I know that they actually, the good habits help me cope, whereas the bad habits, they're the path of least resistance, but they don't help me cope at all.
Yeah, I think the only thing that I could add to this is, maybe she has had some good habits that are now she's not doing. Don't introduce any more bad habits. Don't introduce any bad habits. Just because you're not keeping up with your good habits, don't start to introduce bad habits.